What would I buy today? Well, I'd buy a fractional radio frequency device. I think that's a novel technology that's going to be more intriguing. I would buy devices that have integrated feedback, like navigation cameras in the back of your car that give you skin pigment to help you with your IPL settings. And what would I throw away? I throw away things I don't use. I have a lot of lasers I don't use. They sit there, and I think somebody commented one of their lasers is in their shower at the clinic. So I think I'd throw away some of our non-invasive skin tightening devices because we don't use them that often. That's probably the main thing I'd throw away.
I'd probably throw away the ones we don't use as much, and it's some of the secondary non-invasive skin tightening. The things that cause pain, the things that are inconsistent and variable, that cause a lot of discomfort, and we just tend not to use those anymore. In terms of what I'd buy today, I'm not sure if I understand the question, if I was just starting out or if it was me particularly, but I'm looking at some of the new fractional devices. I'm looking at the combination ablative, non-ablative devices and see if there's any advantage there, and that's a sweet spot. But in terms of me just starting out, my daughter's, Vic was asking me about my daughter who's a dermatologist in a year, and so what do I tell her to buy? And I just still think something like a broadband light source, some kind of a really good IPL and a fractional device would be a really good device to start. If you're having a cosmetic practice, it'd be a good way to start.
I would throw away the companies that no longer exist, because I have a couple devices that even though I have an Ellipse IPL and I love it, but the company's now went back to Dane, or where is it from? In Europe. So you can't get it serviced. So I think it's always important to buy from reputable companies that may be around for a long time. I agree, the non-invasive tightening stuff I think has a lower degree. And I'm with Jay on this. I think when you think of the things you need to do with laser and lights, it's red, brown, and wrinkles. And so if you have an IPL and a fractional ablative, your ablatives you can turn way down or way up, so they're a lot more. And most of the devices you can do full field resurfacing as well as a little surgical spot. So those would be the first two I would buy.
I'm an IPL guy from way back when, so I always tell people the first device should be an IPL. But then I think the fractional devices, whether sublative technologies or CO2 or erbium, whatever you like, that works really well. As far as throwing out things, I think that a lot of us have gotten into as they said, the hype with the non-invasive skin tightening, and it just doesn't work as well as we want it. So, we've all tried them, and I think that some of the companies are actually trying to make them better. But I think if you heard, I'm going to pick on Grant for a minute. Grant gave a lecture this morning, and he said, these are the 10 or 11 devices that I've tried on myself and my staff, and these are the ones that don't do anything. And they don't, and yet people out there, we, at least this panel, we try to tell you what does work, and if it doesn't work, hopefully most of us are going to say what doesn't work. The one with the arms, the Zorona device, I wouldn't throw it away because I use it, as he said, I use it for coats and umbrellas and other things, and so that has a use in my office, but I wouldn't, but there's a lot I throw away.
David.
I would look to buy two potential devices or techniques that are not yet at this meeting. One of them is the AquaGold device, which is this little device that allows you to put products in it and infuse it into the skin after virtually any laser procedure. So you can put toxins in it, fillers, cosmeceuticals, PRP. And the second one to look at is something that we're about to begin studies on, and that's the company is Sebacia, and they have these little micronized gold particles that will be activated by a diode laser, 800 nanometers. And if you've looked at Roxanne Anderson's work from a couple years ago, this actually may be the PDT cure for acne. So those are the things I would think about looking at as we go forward. What would I throw out? A bunch of those cellulite RF devices that do squat.
Uh-oh.
So you get this question all the time. What would you buy today? Well, it depends who you're talking to. What's your specialty? What do you do all day long? Are you a dermatologist? Are you a plastic surgeon? Do you operate in your office? Do you do facelifts? So first thing for basically anybody at this meeting, you need some sort of resurfacing device, either full field or fractional, probably something that does both, because I'm in the operating room a lot and I like to resurface people. And the other thing is an IPL device, because everybody needs an IPL device in their practice. So I'm going to agree with the other panelists. Some sort of IPL and some sort of resurfacing device, both full field and fractional.
I'd throw away anything that hurts, that no one's going to do it. anything that you have to wonder if you're going to get a result or not, or if you're staring with the patient in the post to see if there is a result, and anything that has a really high disposable cost. I don't mean a reasonable disposable cost, but some things are just so high we can't make a profit. What would I recommend to maintain? Skin, fat, and hair, something for skin improvement. Many of our patients want no downtime, so any of those devices. Non-invasive fat, I would definitely be in that, and that's a huge and growing category. And then for hair, any of the either hair transplant or hair devices covers another section that is unaddressed, so skin, fat, and hair.